We'll just wait for. Uh, is that Jayesh? JM?
Hello.
Hey, hi Jayesh.
Hi.
Hi. Hey, Doctor. This is Jayesh. I'll just quickly introduce.
I see.
Hello. Hi, doctor.
All right. Hello, JG. How are you? I don't think we
Good,
ever met
good.
before.
Yeah. How are you, doctor? Thank you for doing this for us.
No worries, sir. Yeah. So where are you from San Antonio as well?
Yeah, I'm in San Antonio.
Okay. Yeah. So sorry we didn't get a chance to kind of meet. We should have actually done a couple of
Yeah.
minutes before, but okay.
So
That's
he's so Doctor. He's based out of. I mean, he works for USA
I see.
as an employee, and he's actually the one who started this group to bring friends and family together in an informal, voluntary way
I see.
to connect and share, our individual journeys. So there are. It's a mix of people that we have in the group. People with conditions, people without conditions, generally people who want to be healthy. So it's a mixed bag. So we'll just.
Excellent. I think that'll be awesome. Yeah. I think, we have, there is so much to meaning. I think we all have, we see so much chronic disease burden today. So I think we can, there's no limit to it. We can always, just set the stage and see, what kind of questions people have. We can go from there. I think it's going to be
Yeah.
a good learning experience.
Sure. I just wanted to do a time check, Doctor. You have about an hour, right? Full hour or?
Right. Yeah, we can do that.
Yeah, I'll probably just maybe give a couple more minutes for people to join and then we can start.
Sure.
okay.
Recording in progress.
Desh,
Yes.
Moringa tea.
Yeah. Perfect. Very good. Yeah.
How is the
And
group?
today,
I mean, is it the WhatsApp group right now?
Yeah, it is a WhatsApp group. So Jayesh is the founder and we are all participants.
it's not like founder. We just thought of an idea. People are joining because everybody is so passionate nowadays about taking care of their health,
No, I think it's important, Jayeshi. It's I mean, back in days, we didn't yeah, it was the health has become a very expensive commodity or expensive part of our life. There's so many forces actually that work against. I mean, of course, right? Thanks to all this technology and comfort and convenience, we are completely carried away by um, the kind of modern life that's what compromising our health and at the same time not only getting sicker, the healthcare cost is going high. So it's not like you just see somebody on the corner a little clinic or physician, and then every ER visit or hospitalization or major procedure is going potentially can make us bankrupt. So yeah.
That's right.
All right. It's, I think people will trickle in. We can get started, Doctor, if you don't mind.
Yeah.
Sure, Jayesh. Yeah, I take over. I think however you like.
Yeah, sure. So what we'll do is, should we start, Jayesh, or wait for one more?
Yeah. People are joining, right? You just shared the new link again. So
Okay.
hopefully we'll see the count going up.
Okay.
And since we are
That's-
recording, I think people are, they know. No?
Jayesh, I have shared the link.
Thank you,
Please join.
Ashish.
Yeah. If you want to give a couple of minutes, I think that should be fine as well.
Yeah.
I had a few items this morning, but maybe you can just, even if you go over 1, 2 o'clock,
Yeah.
should be fine. Because the
Yeah,
value is what matters.
Okay. All right.
yeah, I
Quickly,
think
we'll
we'll,
kick off or
yeah, we will get started. So everybody on the call, thank you for joining, and I'm sure people will start trickling in more and more. But very quickly, what we wanted to do was, this is a session, like I said, the background is that we collectively questions, all of us collectively may have, for Dr. K. He's called Dr. K. And so I wanted to quickly introduce Dr. K, to this group. So Dr. K is he holds a certification in plant-based nutrition, and he was actually a doctor, full-time traditional medicine practitioner, like for 15 plus years, and then he decided to change course after going through this analysis and study, and then he has pivoted his career now to more around lifestyle medicine. So we are happy to have him here, share his wisdom. He constantly works with people in different stages, different types of conditions, and helping them really prevent rather than just cure the disease. So, and he has actually experienced the benefit of the approach that he kind of practices, where he's actually lost 40 pounds himself, blood pressure, all of those values. So it's like a first-hand experience, plus the experience of treating a lot of patients universally. So that's about Dr. K. Thank you for accepting our invite to, for this knowledge sharing session, Dr. Boja.
Well, thank you, Nikhil ji. Yeah, thank you, Nikhil, and Jayesh as well. I think it sounds like you guys are, create a good platform to share ideas and concepts, and share our health, whether concerns and whatever you all have. But thank you. Thanks for inviting us. You have been one of the the chair, amazing patients in our programs. I think that's one of the things and how we are connected. But as Nikhil, described, I've been practicing medicine as a board certified family physician with the University Health System and the UT Health San Antonio here for about 12, 15 years. It's already been. And one of the reasons I think why I decided to kind of, shift the gears is over my 12, 15 years of my practice, obviously, after seeing thousands and thousands of patients, you come to a realization that something, there like some nuances, right? We always think about medical literature and stats, public health and statistics, but and we think that's something happening somewhere else. But when I started witnessing in my own clinic, the obesity, diabetes, blood pressure, cholesterol, heart attack, stroke, fatty liver, all this, and this disability, and then it's affecting every family across the board. And there is no gender or race, boundaries, and then even the country. But now we're living in a global village. It's the world is flat now, and then the technology and everything. So we not only imitate the Western style of living, lifestyle, even our eating habits in our back in India or here in Indian communities has changed. So across the board, we have been seeing an explosion of this chronic disease burden. So that's when I figured that I myself was actually turning into one of those patients in terms of weight and blood pressure, and my A1C was going up too. As a matter of fact, there were a couple of, there was 1 week, 4, 5, maybe 6 years ago. I've seen these patients basically, they come to us all the time, but there was one family that nobody would fit into chairs or furniture we have in the room. So one patient was sitting on the exam table, the rest were sitting on the floor. I was like, what's happening? Because they're extremely, obese, and even the kids. And in the next moment, we had a patient, that we call, frequent flyers. Unfortunately, he comes in the wheelchair, with big, soda on the side of his motorized scooter, and he would never get out of that scooter. He just sits in there, and this is maybe 4th or 5th time with the cellulitis, that infection to his big leg, like an elephant leg. And then I think the next day we had a patient who had a heart attack, and almost like a heart attack. So EKG changes. So we wanted to send to the ER, but it took almost more than an hour or two to send him to the ER, even though we have our own ambulances standing by it at my clinic, because it's a very high acuity clinic. And the reason being that a couple of ambulances came and left because this patient needed a bariatric ambulance. So we heard about bariatric wheelchairs, bariatric beds. He weighed about 400 pounds or 450. So that was the time, I think it's a light bulb moment, that no, we are not seeing on the literature or some kind of, statistics. It's a reality on the ground. And then I myself was getting tired because we usually run our 12-hour shifts, seeing 30, 40 patients a day. And then I said, like, okay, we got to do something. So that's when, I stumbled into, shifting my own lifestyle. And then obviously, experimenting with different things, landed into something called lifestyle medicine. As Nikhil was saying, losing 40 pounds and all the numbers, coming back, we decided to do something about it. In the traditional practice, it's hard to hold a patient's hand and then walk through a different journey, because we typically see every 3 months or 6 months, and then you can't, bring that change in that short period of time, or, less frequent visits. So that's how our clinic was launched. And
Sure.
so that's,
Yep.
yeah, that's the background. Thank you though. Thanks for
Sure.
inviting us, and we'll see. Mhm.
Yeah. So, Dr. K, the format we had in mind was, do you have a set of slides, or we can jump into questions? Either way is fine. You can use the slide to either answer or whatever you are comfortable.
We can, I think, because of, the I didn't have much time, so I actually had a presentation. It might look a little longer, lengthier. I don't know how your time frame is. We can run by that and then get to the questionnaires, so that at least we'll give some time folks to join as well. Either
Yeah,
way.
absolutely. Yeah, we'll go through that. Maybe I'll just time this for about 5 minutes, Dr. K, if you don't mind, because we need to go through a lot of questions that
Okay.
are of
I think
interest.
that, the questions would be good. I think that's where
Yeah.
the value would come. We can. Let me see. I think it's unfortunately I had a huge stacks, but we can run down quickly. I can skip some of the slides. Okay.
Yeah. Yeah.
If that's okay. So we
Yeah.
and then we'll go from any thoughts on that, Jayesh?
No, that's fine. Totally fine.
Yeah. So let me start sharing my slides. There's nothing in there. Okay. So okay, some of the content is actually a little bit different. It's a completion sake. It's a full set, but we'll skip through, and then I think if appropriate, we'll refer back to some of the slides. So thank you. To always say, the learning to lead your health, because we know there's so much out there online, and then so many videos to watch, and websites to visit. It can only make us more confused and overwhelmed. I always remind folks, every time I talk to anybody, in the interest of time, and we're gonna skip through, but always ask my audience to kind of think about these conditions. If you ever heard of these conditions, maybe as a non-medical person, you might have never heard, but in general, these rickets, right? Beriberi or marasmus, a kwashiorkor, or maybe think about tetanus or diphtheria or rubella or polio. Right?
Please
You heard
mute
about
your. Yeah, and I'm just asking others to mute. Thank you. Sorry.
Sure. So just to take a second to see if you ever heard of those conditions, or let alone see any patient around us. We heard about tetanus and diphtheria, but when was the last time you saw a patient with tetanus, diphtheria, rubella, or polio, or maybe the conditions listed above? We don't, because that's the old world. And let's think about a few other things. How about obesity, diabetes, blood pressure, cholesterol, heart disease, stroke, fatty liver, cancer, right? Well, we don't have to look for anybody around them. And we have more than enough around us, because that's the kind of new world we live in. And then the disease spectrum change, disease conditions change, because everything linked to our lifestyle. I'm just going to skip through this. The point of this is basically, we are overwhelmed with mopping the floor concept. Instead of just simply shutting the faucet, we have so many ideas and strategies to mitigate, just to kind of clean the floor, rather than just controlling the source, essentially. And that's how we ended up in this medical maze. There's so many labs and technology, treatment plans, and so forth, and appointments. People are really overwhelmed with their medical care. If you're really sick, end of the day, we don't know where the solution is, where the root cause is. So I think that's the challenge. So the one paradox I always think about is, back in days, in the 1920s, that's how people used to die. And right here, this is how we die. We're not malnourished anymore. We are overfed and undernourished. And that's the huge implications of kind of life we lead. It took centuries and millions of years for humans to evolve from there to there, but it just took if you compare last two individuals, not even a couple of generations, human body shape changed from that to this. So that's the toll, and this is the obesity and then diabetes toll. Unfortunately, we live in this southern states, great state of Texas. Obesity, diabetes is skyrocketing. We spend hundreds of $billions each disease individually, still not seeing any progress. So let me take a second on this right here. What I call is adding life to years, not just years to life. What we mean by that is a quality of life is more important than your lifespan, how long you're alive itself. And then the take-home message is we have enough medicines and technology to extend our life, but our health is deteriorating so fast. People are getting sicker, catching these diabetes, blood pressure early on in 30s and 40s, meaning for 50, 60 years, they're living with disability and so much suffering. And that can only be changed through lifestyle. The one good news is, even though we think of trillions of dollars in healthcare, that only contributes 10% of the care that you can really get. I mean, the difference you can see in your health. 70% is lifestyle related, and that's where the food comes into picture. I'm just going to jump into a couple of slides that are more pertinent to diabetes, which is one of the leading medical conditions we always talk about. As we know, diabetes in simple terms, abnormal high sugars in your blood, right? And how many types of diabetes can we think of? So type 1, type 2 that we always hear about, right? I mean, if you're missing insulin in your body, if your pancreas is not making insulin, that would be type 1, but majority, 70, 80, 90% of the diabetics are type 2, where you do have enough insulin, but your body cells are not responding to it. And we call it insulin resistance. And there are a few other types, gestational, pregnancy related, and a few other types. But when we talk about type diabetes, we almost always, describe it as type 2 or a C in the community as type 2. How do we check it? We used to check, the sugar in the urine back in days. And by then it's already too late. Patient has advanced diabetes, but you can check the sugar in your, finger prick, either fasting or non-fasting. But the most recent standard of care is A1C. So you can check your hemoglobin A1C, which represents your average sugar level in the past 3 months. And if that level is 5.7 or low or less, we would call it normal. Anybody with hemoglobin A1C of 6.5 or over would be considered as diabetic. And there is a middle zone. There is a gray zone, and that's where we describe them as pre-diabetic or early diabetes or on the borderline diabetes. So if your A1C is 6.5 or above, you're diabetic, or 5.7 or under, you're normal. In between would be pre-diabetes. And then unfortunately, there's more and more population, actually people are shifting into pre-diabetic phase, meaning you don't have the typical symptoms of diabetes. So you wouldn't even notice unless you get your blood work done. And it's not just in the general population. We are seeing in the medical field as well. Most of if you line up, 100 physicians or nurses or medical professionals, I'm pretty sure more than half would come back pre-diabetic or diabetic. And that's the magnitude of the problem. Well, how does the insulin work? Well, when you eat the food, the signal goes to your pancreas and it would release insulin. And that's the hormone that would go to each tissue in the body and would open up some channels on each tissue or organ or cells. Meaning, when you eat food, the carbs breaken down into glucose and gets into your bloodstream, they cannot stay in the bloodstream forever. It's like traffic. Imagine the traffic. You can't have all the traffic, entire traffic of the city sitting on the highways. Highways are only meant to transport, right? Transportation. You must end up in some kind of building or parking lot or house. So you have to have a home for these glucose molecules to go. So, but if the cells are not taking up those glucose, that'll be a trouble. How does it happen? Well, when the glucose enters the bloodstream, every cell will get a insulin signal to open up the doors so that the glucose can get into the cell. Well, that sounds very simple, and that's what our body would do naturally. If your pancreas is not making insulin at all, well, obviously there is no insulin, so this glucose doesn't know how to get into the cells. So that patient would end up with 500, 600, or 1,000 glucose in the bloodstream, and they would end up on insulin for life. Well, that's not the case in majority of the individuals. What happens is, even though your pancreas is making the insulin, your cells are not responding to that insulin signal to open the gates or the doors for the glucose to enter the cells. So when these cells or tissues in the body are not opening up the doors, what happens to the glucose? Obviously, it would pile up in the bloodstream. So when you stick your finger and you get the blood out of the blood vessels, and that's where you see the sugar going up. And this is exactly how it works. It's like the key and lock system. So even though you have a lot of insulin in your body, that's receptor or that signaling system is actually failed. As a result, your glucose is not getting into your cells. And this picture explains the same thing right here. Then the next question is why? Why are my cells or tissues or organs have become insulin resistant? And then they are not responding to the insulin. So pancreas end up producing more and more insulin in an attempt to achieve the goal. But that excessive insulin in the body itself can be a troublemaker. So if you step back and see, why my cells are not responding, why are they resistant to insulin? Well, unfortunately, there are a lot of forces, factors, play into. Some of the studies that actually is shown, one of the fascinating facts that the intramyocellular fat, lipids, meaning the fat cells are the fat that is accumulated inside each cell, especially muscle cells, does interfere with the chemical process, because our cells are like microchip computers, basically. They have hundreds and thousands and millions of chemical reactions happening. This is not just the insulin versus glucose.
Sure.
So among all the, please.
Sorry, and then Doctor, thanks for that, quick, at least deep dive into, what's probably the root cause of it. And I think what will, if you don't mind, we'll switch to the questions, because that I think you've laid a good foundation of, what's causing all the other, probably all connecting all the other questions we may have.
Absolutely.
So I would request Jayesh to kind of share the questions, maybe just one slide here on the insulin resistance, I think, because this is also one of the questions. But Jayesh, why don't you get started with the questions?
Okay. All right. First of all, thank you very much, doctor, for your time. And thank you, Nikhil, to work with the doctor. We really appreciate it. So first question is basically, should a pre-diabetic use CGM, that's continuous glucose monitoring? And if so, for what exactly?
Absolutely, yeah. The CGM is a continuous glucose monitoring. It's a very fascinating technology. So basically, instead of pricking your finger, you can use this little, it looks like a patch. It has a needle and sensor. You put it on your arm or belly, depending on the brand. The purpose of the CGM, or the continuous glucose monitoring, as the name infers, it continuously, checking your glucose and showing up on your phone app on your phone. So the purpose is to see how my glucose is trending. That's the bottom line. But it was reserved for type 1 diabetics and insulin pump, because it's very critical to know the insulin sugar levels. And then we started using on diabetics as well, with insulin or without. And the question is, can a pre-diabetic use the monitor? Well, the answer is yes, because it doesn't harm. It's not a medication. All you're doing is basically you're knowing your sugar trends in real time, in 24/7. The next question is, what is the point? I'm not even diabetic. What's the point of using it, right? By knowing the trends, you can detect the triggers. What kind of an exercise, sleep pattern, and actually the food is affecting my spikes. Even though you're not diabetic, even if your sugar going beyond 140 or 150, doesn't need to be 180 or 200. Those little spikes are actually, now the science is showing that they're predictive of future diabetes and future complications. So there is a value to it. but your insurance company might not cover it. So it's always in a case by case, depending on how you find your coverage.
Okay.
Go ahead,
Thank-
Jayesh, continue. Yeah.
That helps. Thank you. So another question, now we are trying to switch the direction here. What are the various ways to manage our gut health?
Sure. Oh, actually, so we didn't touch on that, but I think gut health is a very important health. We thought it just a constipation or diarrhea, just kind of bowel movements was the end of the story, but there are trillions and trillions of bacteria which live, that's a symbiotic relation in our colon, large intestine. And for many years, so we thought that, okay, that just, bacteria just, create some chemicals and forms the stool. But now more and more studies are proving that every single disease condition we talk about, diabetes, all these blood pressure, cholesterol, heart disease, cancer, even the mental health, is directly linked to the gut microbiome. So collectively, those trillions of bacteria are called microbiome. It's like a colony, right? But there are hundreds and thousands of varieties of these bacteria, or different classes and families, depending on how the distribution is. Good versus bad bacteria is where our health would determine. So it's very critical to know where you are. Unfortunately, it's not a simple blood test. But Jayesh, if you don't mind, what was the crux of the question again?
Same, I mean,
How can I change?
how can I manage and have a better gut health?
So the question is, what determines, what decides, what kind of bacteria, good versus bad, do I grow in my belly, right? So
Yeah.
the food, ultimately, the food is the source, obviously. And the tricky thing is, the food that you eat, 99% of the food is not the food for that bacteria. And you digest and you absorb and all that. The real food for that bacteria is fiber. And there is a flip side to it. Fiber is basically, it's a type of carbohydrate, but comes only from plant-based or plants or vegetarian diet. And that is the only food, I mean, predominantly that is the food for these bacteria where you cannot digest and take advantage of the fiber. So the interesting thing is the fiber, which is not a nutrient, or we thought it's negligible for humans, is the food for the bacteria that you gut microbiome. So you have to have your fiber in your food. And as a matter of fact, predominantly we are all fiber deficient than protein or any vitamin deficiency, anything else. So by having good fiber in your diet, I think that's the key to grow good bacteria. And that's how we change the insulin signaling. And even if you eat the same food with more fiber, your glucose spikes would be less, your fructose spikes would be less, your insulin spikes would be less. There is so many other things are directly related to the fiber
Okay.
intake. Simple answer is fiber.
So
Yep.
are you suggesting that we should go over the counter for fiber, or just focus on the natural food, organic food for the fiber?
So technically, you can say fiber is what is needed, but if someone is purely deficient, a lot of issues, if they cannot increase the fiber, natural fiber intake, obviously they can use the over-the-counter fiber sources. But there is a lot of science behind. When you take the pure fiber, it doesn't do the same good as the natural fiber. So we always
Okay.
recommend natural fruits and vegetables and grains in the
Okay.
natural forms.
Okay, thank you. Nikhil, you want to take next two questions?
No, go ahead. Continue.
All right. So next question is, what is the role of vitamins and minerals in our metabolism, insulin or hormones, and how do we detect deficiencies?
Right. Well, I think that's the definition of vitamins and minerals. So these carbs, fats, and proteins, we call them macronutrients, meaning the big guys,
Yeah.
because they carry the calorie value. But there are a lot of micronutrients, vitamins and minerals and phytonutrients. They are very small particles. There is no calorie value. But all these hundreds and millions of chemical reactions and happening in the body, they require these coenzymes and the little little minor players in that chemical reactions. And then they were defined and described as vitamins and minerals. So they are critical. I mean, if you eat natural food, complete food, you would get enough. There are blood tests depending on what you're looking at to check the levels. And then you can, there are ways to make sure that you get in the food, or if you're completely deficient, you need the supplements.
Okay, thank you. Next question is, what is your guidance on doing blood work to assess metabolic health and conditions like thyroid, insulin resistance, etc.
Absolutely. Yeah. Obviously, yeah, that would be the blood test. The word metabolism is a pretty global word. There's no such thing as like let me get a check for my metabolic health. But all these, as you laid out, your thyroid, your insulin resistance, and kidney function, liver function, and your inflammatory markers. Especially in our program, we have a huge suite of labs that we run. So there are different metrics of the labs you can get, and you can talk to your PCP or your specialist to check the levels and take actions appropriately.
Okay, thank you. Next one is a little technical. Can you help us understand glycemic index and glycemic load and how it can help us plan our food?
Absolutely. I think that's a very critical, very important question. Honestly, I don't think an average, individual would even think about it, know those terms. Let me break it down. So glycemic index versus glycemic load. So what we are talking about is how much glucose or the simple sugars do I have in the food that I'm going to eat. The total amount of glucose in the food, given let's say a bowl of cereals or any food, total amount of glucose would be called glycemic load. Meaning, if I finish the entire cup of that food, this much glucose I'm going to get. That is the glycemic load. We thought that's important. That's how people always recommended, don't eat carbs and don't eat too many carbs and so forth, right? But the next concept is glycemic index, meaning even if I have two types of foods and they have the same glycemic load, same amount of glucose, they don't do the same level of glucose spike in your body. And that's where the description comes into a picture, like a glycemic index, meaning which food would spike the sugar fast. So within 20 minutes, the whole sugar comes and goes and then confuses the body, versus the other food would actually come slow and it lasts longer.
Okay.
That's
So
the fundamental.
which one we should watch out for? Glycemic load or index?
Well, technically, you should look for both.
Okay.
Because but glycemic index is more important, especially if you're diabetic.
Okay.
Because even if you're getting 100, let's say 10 or 20 grams of glucose, if you get all of a sudden like a spike, your body goes into shock. Insulin comes in, and then everything gets into a shock mode, and then instantly you feel like low sugar. So index is more important for diabetics, but load should be considered for all.
So the threshold is what? Below 50 we should target?
Yeah.
Okay. All right. Thank you. Next question is, what are the vegetarian, vegan sources of protein that you would recommend?
Sure. Again, there is a little distinction between vegetarian and vegan. We always, we are vegetarians because the one thing that separates vegetarian from vegan would be dairy. Of course, in Western world, even egg is considered as vegetarian. But yeah, if you take out egg and dairy products, meaning milk, cheese, butter, paneer, and all that, then it turns into vegan, completely plant-based. So that's the distinction. And so your question is about proteins, right?
Yeah.
So we always think
What's
protein equals muscle, right? That's the difficult concept to break, belief system to break. So the lots of proteins. As a matter of fact, the proteins that even the animals make and then get comes from the plants itself. So obviously so vegan source would be, we always teach in our program is that there are lots of sources. Basically, if you go to legume class, legume means beans, lentils, and chickpeas. So especially in our Indian diet, we have chickpeas, chana, right? That's a great source. And then the lentils. Lentils, there are a lot of dals. All these dals come into lentil class. And then soy, we don't use much soy in our Indian cooking, but soybean and then any product that comes out of soy actually is a good source as well. In terms of reality, of course, these beans, there are 100 different types. Rajma is a common one, right? There are 50 different types of beans, and then these chickpeas and lentils. And from soy, one of the easy quick source would be or tofu. Tofu looks like paneer. Of course, it tastes different and texture is different. There are different brands to pick. But that would be the primary source. And of
Okay.
course, we have proteins in all vegetables and all millets and grains. Of course, the proportion would be different, but the lentils or legumes would be a dominant source of protein.
Okay. Thank you.
Mhm.
Moving on, what is your advice about fruits? Like, what is the best time to consume fruits? How much? And which ones are better or best to avoid? Meaning, right now there is a mango season, and in India there is popular apples, in the Maharashtra side, people like it and they eat it like anything. So,
Right.
suggest the time and the quantity that one should go for. So,
In general, fruits are because as long as it's a fruit,
okay,
because when fruit turns into fruit smoothie and the fruit juice and the fruit concentrate, the entire science changes and the body,
okay,
responds differently. So, fruit as a whole fruit, as such, you cut, slice, and eat as such.
okay,
In general, they're safe because they are packaged in such a way that there is a good proportion.
okay,
If you're diabetic, definitely, you should pay attention. If you're non-diabetic, I wouldn't worry much about the quantity
mm,
and then the timing. But one principle we teach our patients, especially who are diabetics, are timing. You asked the question about timing.
yeah,
Within the meal time, we recommend to save it for the as end as a dessert because sugar, I mean, fruits by definition have more sugars. Um, Even though they are natural, they're much safer than the sweeteners and sugar or table sugar. So
mhm,
save it at the end because you need to start with the fiber and then the protein and fat content, and then take the fruits rich in sugars. So you wouldn't get the same spike that you would get if you eat it
okay,
first.
okay, makes sense. And some people say early in the morning is better. Don't eat in the night before bedtime. Any comments on that?
Right. I wouldn't see much, the difference. As a matter of fact, as a whole, I think that's a holistic food.
Mm,
Morning breakfast, I think that's for a lot of our patients. Actually, it's a choice, a bowl of fruit, a fruit bowl, different types of fruits.
mm,
The one last suggestion would be technically you can try anytime. If you are diabetic or if you're using the CGM, we always teach them to see how your own body is responding to the glucose spikes and
mm.
then adjust accordingly.
Okay, thank you. Now, moving on, this is something we came across. Like some research is saying eating sugar can lead to cancer, like mitochondria function. So, what are the chances of, pushing ourselves towards cancer by eating more sugar?
Let's see. Well, that's sugar does play a lot of role actually. The sugar itself, glucose especially, and sugar, it causes a lot of inflammation.
Mm,
So triggering a lot of different metabolic processes. I wouldn't think sugar causes cancer. But the only way I can explain or support that idea is the cancer cells, by definition, it's an overgrowth, meaning growth out of control, right? Out of
mhm,
proportion, out of control. They're exponentially 100 and 1,000 times in a growth rate. And every cell would need oxygen and glucose to grow and multiply and survive. So
mhm.
basically, your oxygen and glucose are the fuel. If I support that idea, I think that's the only way that I can explain. But purified sugar does cause a lot of inflammation and other health issues. I can't tell that sugar causes cancer directly.
It will fuel more, basically. It will help
It
augment.
does. It
Okay,
yeah.
okay, thank you. Next, coming back to the insulin resistance, we hear that insulin resistance is a root cause of several metabolic disorders. What exactly is it, and how can it can be managed?
Right. Well, I think, yeah. So this is a very fascinating slide. I'm glad we have that slide up on the screen. Insulin resistant was not even a point of discussion. Even in the current practices, we don't talk much about it in general practice. People who are actually more inclined towards a diabetic focus and trying to get this metabolic syndrome under control would talk about it. But this is the root cause. In short, insulin resistance is the underlying root cause for your so-called type 2 diabetes, right? Diabetes is basically high sugar, and the root cause is insulin resistance. Your cells are not responding to insulin. It's that simple. But we almost always refer it to type 2 diabetes. But as you can see on the slide, insulin resistance is actually goes far beyond diabetes.
Yeah.
Pre-diabetes and type 2 diabetes. Gestational diabetes is like during the pregnancy. And it does trigger a lot of metabolic processes towards cancer, inflammation inside the blood vessels. That's where the clogging would happen. And if it clogs, the arteries clogged in the heart, close to heart would be heart attack. In the brain would be stroke. Blood pressure, these atherosclerosis and kidney problems, especially more and more patients. I want to take a second on a PCOS, polycystic ovarian syndrome.
I think some people say they are not able to see the slide. Maybe you want to bring it up again, or
Okay, let me see. I think I stopped sharing. So
I was able to see.
how about now?
yeah, we can see it. Thanks.
Okay. Yeah, like I said, insulin resistance is the root cause for many conditions. PCOS, I always emphasize that is polycystic ovarian syndrome. I don't know if you heard about it, but more and more young ladies are actually not only getting obesity issue and menstrual problems. Infertility has become a big challenge nowadays. Of course, both men and male and female are contributing, because even the sperm count and sperm functions are going down on youth. After marriage, the IVF clinics, infertility clinics have gone all over the place, even in India. So people are struggling to get pregnant. And one of the underlying causes for the women, young youth, is insulin resistance leading to PCOS. Surprisingly, if you notice anybody, their OBGYN doctors are putting them on metformin, thinking that it will fix the PCOS. No. Metformin is actually only controls the glucose, because even that glucose is coming from the insulin resistance. So they are forgetting where the leak is. Instead, they're putting a lot of band-aids. Again, I'm not undermining what they're doing, but the point is they're missing the target.
Right.
And then a lot of other things. So even the ED, erectile dysfunction. So there are a lot of mechanisms, including fatty liver, which is the biggest one. So it's a huge role across the board.
Okay, thank you. Next is something about the lifestyle. We talk about intermittent fasting a lot. People do it. So can you talk about its role in managing our metabolic conditions?
Right. Well, that's the one interesting area, actually, JSG. Intermittent fasting, it sounds fancy and modern, all the high tech, but technically it's nothing but what our ancestors taught us, and what our traditional practices recommend. We used to fast once a week, or maybe there is a season for fasting season, right? Navratri,
Right.
or it could be
Yeah.
So what it does is basically you're giving your body a break to clean up, clear the process, all the metabolites and all that. So
Toxins.
there is a day-night cycle, and then body, every tissue and organ requires time to recover. It's like a cleaning. Your cleaners should come and clean the office. You can't have the office open 24/7. So it's in simple terms, but it's a lot of science supports it. How you do it, how many hours, it's a different topic. I mean, meaning detailed topic, but intermittent fasting does work. It works across the board for diabetes, obesity, blood pressure, a lot of areas you can cover. And then even actually one of the Japanese scientists got a Nobel Prize for a concept called autophagy, meaning, renewal, recycling of our old used up cells. And one of the ways to trigger autophagy is intermittent fasting after 16, 18 hours.
Okay, thank you. Moving on, what are some ways to manage our sleeping habits, and how does that impact overall health?
Right. Let's look at the second part first. Does sleep affect our life? Yes. It's not just the tiresome or fatigue or lack of sleep. When we go to sleep in the night, you're not just throwing your body on the bed and just relaxing your muscles. There are thousands of hormonal reactions in the brain and the body happens. As a matter of fact, every organ in the body, every cell has a circadian rhythm or clock, day and night cycle to do their jobs. So if you don't have enough sleep, especially at nighttime, they will get confused. All the hormones get chaotic. That's where the cortisol kicks in, high stress. As a matter of fact, all the diseases we're seeing can be linked to our poor sleeping habits. So both quantity and quality and circadian rhythm. Matlab, Just 7 hours sleeping in the middle of the day is not equal to 7 hours from 10 p.m. to 4 5 a.m. So having said that, how can I fix my sleep cycle, right? I think that was the first part of the question.
Yeah.
Unfortunately, there are a lot of forces keep us up. We don't follow this day-night cycle, sunrise, sunset, because there are a lot of technology and our job responsibilities keep us awake. So unless we give a priority, you can never achieve that goal. So what we teach is mark at least if you go to bed in the middle of the night, 11 p.m., 10 p.m. 9 p.m. would be ideal, but the latest would be 10 p.m. to go to bed. There is a lot of ways to sleep hygiene practices, minimize your phone. Thanks to iPhone, at least Apple has a sleep cycle setup. If you set up
Yes.
your bedtime and wake up, it will wind down all the apps and everything. There are different ways to do that, but the first thing is you must give it a priority. Both you and your spouse and family must be committed to go to bed early, and then work on strategies.
Right. Thank you. Yeah, I've been doing that actually. Thank you for that. How do we know which carbs are good and which ones to avoid, like simple versus complex?
Right. For many years, we demonized, carbs. We thought, carbs are the enemy, and then avoid carbs so you don't get diabetes and all that. But technically, we require at least 60-70% of our nutrition or diet should be carbs. But the challenge is because we had rice in all Asian countries. Rice and wheat are the two staple foods. Rice as such in Asia, and wheat in Western countries in terms of bread, right, in the form of bread. But the challenge is they are rich in carbs. But now more and more refined carbs, polished rice, and then refined carbs where they strip off all the fiber, that turns into trouble. So it's not the carbs that are in trouble, they must be avoided, but the simple carbs. And then by definition, simple carbs are not like anything unique, but if you take a grain, like let's say brown rice or the whole, rice grain, when you polish that, go through this mill, right, rice mill, the more they go through 2-3 cycles of milling and then polishing so that the grain looks white. So the fiber is stripped off, and then all the flours, or maida from the wheat and all that, they take out the fiber so much that there is no fiber left. So it serves a different purpose of making different types of bakery stuff and all that. And that's where all these carbs would flood into your bloodstream and confuse the body with a surge of glucose, because there is no fiber. So simple carbs must be avoided. And the easy way to look at is any sugars, added sugar. We teach on our program label reading. So look at the total number of carbs, and then immediately the second line would be fiber. If the fiber is going, hand in hand with the carb, probably you're saved. And then the last line would be added sugar. Any added sugar would be a simple carb, and you should avoid that.
Okay, thank you. That helps. Moving on to the protein again. How much protein should we eat in a day for good metabolic health? And how can we get, again, it's a vegetarian, same question. Yeah.
Sufficient, right? Yeah.
Yeah.
I mean, obviously, the protein is a building block for enzymes, not just muscles. Your enzymes and a lot of other, the different elements in the body, your connective tissue, your ligaments and tendons and all that. So protein is essential as long as you have, 20, 30, 50 and 20% of your total carbs in a day sufficient. In terms of number, there are different numbers you see in the literature, but in general, they say 0.8 to 0.1 a gram of protein per kilogram. In simple terms, let's say if you don't have any medical problems, for simplicity's sake, 1 gram of protein needed for each kilo of your body weight. Let's say average individual, 50, 60 kilo human individual. I am 60 kilo body weight, and then I need 60 grams of protein. So that's the simplest way to look at it. And then again, it depends on, you should be on the lower side unless you're working out and building muscles and lifting weights. How many people are doing that? And then if you don't do that, if you do more of that for athletic work, you might need more.
Okay. Right.
Good.
Excess
And in terms
protein
of the
can
source, we talked about the source, right? Yeah.
Right. Yeah. Now, this is a kind of different question. Like, what is the connection of asthma and metabolism, and any correlation between asthma and our eating habits?
Wow. That's a very interesting question. So I wasn't expecting that in this kind of discussion, but I'm really happy to hear that because
Yes.
the so-called asthma and all allergies, seasonal allergies and asthma and wheezing and all that. Unfortunately, we overdiagnose it in this country, and every kid is on allergy medicine and albuterol and nebulizer. So, one link that we can connect in terms of nutrition is yes. One of the reasons we advocate plant-based nutrition is milk and dairy and a lot of other pro-inflammatory foods trigger a lot of inflammation, and that actually accelerates our allergy process. Because by definition, asthma is a type of allergy in lungs, not
Okay.
just in sinuses. So if we avoid, all these refined stuff and animal-based products, especially dairy, is known to be there are a lot of science showing that dairy, meaning milk, cheese, butter, and paneer sources, would increase the mucus production in the respiratory tract, meaning ear, nose, and throat and lungs. So mucus is designed to clear all the junk or foreign body coming into your body, meaning these allergens and virus and bacteria. But when you overproduce, it overwhelms the respiratory system and triggers more inflammation and more asthma and allergies. So a lot of people who are following the full plant-based nutrition and would actually come off of the allergy medicine, reduce the asthma incidence as well.
Okay. Thank you. That helps. And moving on to the question in the chat box now. Uh, okay. So question is, when we talk about the blood pressure, how can you recover from high blood pressure, which is white coat anxiety? Basically, as we keep the blood pressure instrument on hand to measure, blood pressure keep rising, just the anxiety increases, and then reading keeps coming higher. It happens
Right.
with me. Thank you for that question.
Absolutely. Yeah, sure. Well, yeah, the blood pressure can be tricky. I mean, the way you're testing, there shouldn't be I think we're talking about bias, right? Situational bias or,
Yeah.
testing anxiety. Sometimes
Yeah.
if you cross your legs and if you didn't take a deep breath and relax. So yeah, you should be relaxed and not crossing your arms and leg is one thing. And make sure the cuff itself, the size and dimensions matter. If you take a smaller cuff on a big person, you may get false high. If you get a big cuff on a smaller person, you might get a false low. So that's number one. Number two, the so-called white coat hypertension, it has nothing to do with the white coat, but actually the situation, environment itself, right? I went to the clinic. Oh my God. Okay, they're testing. So, the one strategy is just you need to kind of relax yourself. And don't get too anxious. And then if you have a device, make sure the device is correct, and then check it in a few minutes. We recommend something called Ujjayi breathing, which is like a deep breathing, a 4 second in, 4 second pause, and 8 second, exhale. When we practice, we see patients dropping their blood pressure by 10, 20 points, just doing that naturally. So that's one strategy if you're too anxious every time.
Okay. Thank you. Now, this is more of a widespread and cultural problem, I would say. So we all love sugar. We grew up, eating all sorts of Indian desserts after meal, before meal, right? So
Right.
it's part of daily routine for most of us. So how do one overcome that habit? Like, what do you suggest there? Like, what's your recommendation?
Well, thank you, JJ. I think you emphasized that the root, I mean, the cause itself, meaning the problem. So the frequency, two things. These desserts we are seeing actually extremely refined. If you go back and then look at the farm, how they make these, all these, gulab jamun and then all that,
Yeah.
they're ultra refined and they're pure simplified sugars, empty calories. So, I think we need to build the awareness first. That's one thing we teach in our program, that be aware of what's going into your body and how it's affecting how you're feeling. We override a lot of times after having a big biryani and then there's, either gulab jamun or any kind of, sweets. Now we are adding ice cream to that. That itself is actually 300, 400, 500 calories. So
Yeah.
to just give you a little solution, I think the question is about how can we overcome or, kind of defeat
Yeah.
that. Well, look up, the two gulab jamuns and ice cream together, at least 300 to 400 calories. Okay. And we
Right.
don't just sit around and eat it. And after maybe heavy meal or maybe back to back. So one suggestion I would make is whoever listening and then maybe eating that, eat that and then get onto the treadmill, try to burn 400 calories.
Yeah, it takes 1 hour.
See yourself how long it takes, how much you need to sweat, and how much gasping it will happen.
Yeah,
And then ask yourself, if I didn't get onto the treadmill to burn that off, where did all those calories go day after day, right? And then it builds a perspective, and then just try that, but maybe cut down on the quantities. I think
yeah,
that's the beginning, and that's the initial first step I would suggest.
yeah. That's how we are building our tummy.
Right, absolutely.
Yeah, turning into fat. Yeah, it's a
I mean, in
yeah,
terms of calories, and if I can emphasize in a few seconds, if you see these calories, convert them into currency, right?
yeah,
And unfortunately, it's a flip side. It's inverse. So every calorie that goes into 100, 200, 1,000 calories going to my body, see them as your credit.
yeah,
If you keep on building your credit on the credit card and then not paying off means now you're burning, right?
yeah,
Without burning, without exiting calories, where would they go?
yeah.
The only
Right.
way for the body, a lot of people actually think, let me take a minute right there. People think, I think you might have seen, oh, I have my friend, who is very obese and overweight, but he doesn't have diabetes, blood pressure, cholesterol, nothing, man. He just has
Mm.
snoring and all that. He gets tired, but he doesn't have any medical problem. And look at me, I'm skin and leany, and then I have all these problems, right? Well, here's
Mm-hmm.
the trick. Our body actually, they should respect how their body is, showing the results. Meaning, our body knows how to process. But when we load so many calories, the only way to store that is in the form of fat, or adipose
Yeah,
tissue. And we
yeah,
have limited number of fat cells. So basically, their body is doing the right thing by sending it to the reserves. Okay. And your body probably not saving there, but showing up in the bloodstream in the form of cholesterol and glucose. So sooner or later, once they flip on one day, they will go home from the hospital with 5 different diagnoses and already extreme conditions. So yeah, think in terms of calorie intake in and out.
yeah,
Unless I'm running 2-3 miles a day, I don't deserve to eat this much.
yeah.
That's it.
And that the skinny fat would be the visceral fat, right? Around the organs.
That is the visceral fat. Unfortunately, that's where insulin resistance builds up as well. Yeah.
Yeah. Yeah. People think that they're skinny, they're not fat, so they're healthy, but they don't know how much visceral fat they're carrying.
And then unfortunately, it's very true in our Asians, Southeast Asians, Indians. There are a lot of studies showing that. And because of the same reason, our BMI threshold is less.
Yeah.
In Asians, we don't call obese, you don't wait until 30 BMI to call obese. 27 would be good, 23 would be overweight. So I think
Yeah.
that's enough on that topic.
Okay. And here's the last question now. How much does exercise and being physically active really impact our overall health? Is there any general guidance for a healthy individual?
Sure, absolutely, absolutely. So we actually have a couple of slides we can actually flip through, but in general, exercise is not just burning calories. Exercise is not reserved just for the athletes. Everyone must be doing. And in the back in days, it was a built-in part of our life. Now we don't do that. So you don't walk to the work, you don't walk to anywhere. So we have to do that. There are lots of science showing there are different chemicals are released when you exercise. So they're called, actually, they gave it a collective name, exokinins, basically, just like cytokinins. So let me just get to a couple of slides. I think that should help you
Yeah,
to
yeah, yeah.
get.
So we
Okay.
concluded our questions. Anybody here on the call after Dr. Slide, free to ask anything, okay?
Yeah.
So
Thank
the
you.
one, the little slide is basically, I call it primordial pillars of life, meaning eat, move, and sleep. Meaning, as long as, I mean, nowadays humans are not eating like humans are not moving like humans are not sleeping like humans. So when those three pillars are shattered, no wonder why we're getting this health crisis. So we are carried away by our responsibilities. So this is about diabetes getting worse and reversing. But let me get to the there are diet stuff. Get straight to your exercise part. Yeah, right there. Okay, so let me start with just a take-home message. The ultimate, final recommendations are every individual must engage in 2 types of exercise, meaning cardio and strength training. When we think of exercise, we might think about running on the treadmill, on the trail, right? Or the cardio, anything that raises your heart rate beyond 120 is considered as a cardio. That's where the cardio comes from. It can be walking, jogging, running, swimming, walking your dog, or running with your child, whatever it is. So the recommendation is at least 150 minutes per week, moderate exercise. Meaning if you break it down, 30 minutes times 5 days a week would be good. Someone like, I mean, I think we all are professionals. We don't have, let's say, I don't have 30 minutes to run or do anything. You can actually shrink it, crunch it into 15-minute cycles. So 70 minutes of vigorous exercise per week is enough in terms of cardio. You can't just say, I'm going to run, 4 miles, 5 miles every Saturday. Probably you don't get the same benefits. It must be distributed across in small quantities. The second part we undermine and we forget about is strength training, because we always reserve the strength training for athletes or some kind of bodybuilders. No. Strength training doesn't need to be bench pressing heavy hundreds of pounds. Anything that actually puts a strain on the muscles is considered strength training. It can be push-ups or pull-ups or squats or lunges, using any bands, using maybe little weights, 5 pounds to 20 pounds or 50 pounds, depending on where you are. Most of the times we recommend, using your own body, so you don't end up with excuses. You can do push-ups and pull-ups and, Pilates and different lunges and squats. So there is no reason why you shouldn't be doing. And even if you're doing 5, 10, 15 minutes a day, that should work. But there are different ways to achieve the same goal, at least twice a week. I guess the question is, why should we do that, right?
Yeah.
So how does it affect? Let me do this. It not only burns the calories, that's number one. Your heart and lung are actually optimized. Cardiovascular function, unless you use the function of the heart and lung, why they're designed, they just like a junk car. You're just turning your Mercedes, putting on the driveway for 6 months and catching junk, right? That's what happens. I want to emphasize one point right here, especially in our diabetics. We recommend strength training because liver and muscle are the two largest target tissue for insulin and the glucose. If your liver is not in a good shape, your muscles are not in a good shape, both in quantity and quality, you end up with insulin resistance and diabetes. So by increasing the strength training, you are not only increasing the muscle mass, but each given muscle fiber would have more and more mitochondria. I heard you mentioning using the word mitochondria somewhere.
Yes,
so this is
about the cancer.
right? Cancer. Every cell requires a energy calorie burning machine. So each cell, trillions of cells in the body have something called mitochondria. So all these, burning will happen here, just like your combustion in the car. If you don't have mitochondria each given cell, or if they are lazy, you don't get the job done. So that's when the trouble comes. So by strength training, you improve both quantity and quality of mitochondria, and you will see a great change in your glucose control and your diabetes and A1C insulin resistance. And the other reasons would be strengthening. When you do the exercise, it's very magical. I think that's how Mother Nature works. If you engaged in a moderate physical exercise, remember I told you every cell requires insulin to pick up the glucose to open the doors. When you do moderate exercise, like jogging and then running, actually there are alternate gates open for the same glucose without depending on the insulin. How good is that, right? So whether I don't have insulin type 1 diabetes, whether I have insulin resistance, you can open these magic doors, alternate pathway, by engaging in a strength training and this aerobic exercise. Good. I think that covers it. In terms of osteoporosis and bone health as well, you need enough weight training for the balance, for your joint function and your osteoporosis. Remember, a lot of people complain knee pain. I have knee joint pain and hip pain. It's actually not always the joint issue. The muscles and the ligaments around the joint must be strong enough to minimize the force on the joints. Otherwise, those two bones are crushing each other, your thigh bone and your leg bone. So strength training is key for many reasons.
Okay. All right. Thank you very much. So anybody here on the call, free to ask question. It's open floor.
Please, yeah.
Doctor, I wanted to check. You have about 5 minutes, right?
Oh, yeah, sure. Yeah, I think we're good. Yeah.
Yeah. Anybody, any question?
I had one. Yeah.
Sure.
So, I'm 25 right now, and I've been on a keto diet once before in my life. I was just wondering if it's safe to go on a keto diet, and if I do, how long should I continue on that?
Oh, thank you, sir. Oh, I didn't get your name.
I'm Satyajit.
Satyajit, okay, thank you. I think Thank you. I think at 20, it's pretty early on. I think you're getting into the health conversation. But okay, the keto diet has been, I think it caught a lot of attention in the past 5-10 years. Well, I'm not a big advocate of keto diet for a lot of number of reasons. Because of the negative side effects. So the only reason, meaning the only situation where you can do it, if you're extremely obese and you're trying to, defeat your diabetes and all, whatever the results you want to get, keto approach, probably it's good, it's it's fast, but it should be short lasting. You cannot do for years and years, maybe a few months, the most, a year. Because it does give surprisingly a lot of good results, meaning, weight loss, blood pressure control, even sugar control, cholesterol control. But everything is on the surface, everything in the surface, because by definition, what you're doing is, remember I said 60 to 70% of our calories must come from carbs, because every cell requires glucose and carb dominant, metabolic, life. But when you stop the carbs, that's what you're doing in keto, eliminating all the carbs as much as possible. So body would say, where do I go? Well, I will give you fat. Go ahead and burn the fat. Fat is not easy to burn, but when there is in absence of glucose or carbs, body would switch to these fat metabolism. And when you break fats down, you don't get glucose, but it gets something called keto acids. And those molecules can be the alternate fuel source for the cells. And that's how the cells are surviving. And there is a lot of changes happen. That's how you lose weight and everything else happen. But two cautions are, actually three, I'm sorry. You're not providing carb to the body and then trying to check and see if you have any glucose spike in your body. If you don't even load the body with glucose, would you find any glucose on your check? No. So that's how we get fooled. Diabetics, oh my God, my sugar is gone, my A1C is low and all that. Well, if you ask the real question, without even putting the glucose in the body, how can I ask my body to see, how it's doing? So when you go back to normal diet, or even if you take a little bit of, carb diet, your sugar will skyrocket because you avoided the carbs for so long, so body forgets to process the carbs. And insulin resistance is actually building up and so high. We do that in our patients who actually come from keto diet to our program. Their sugars are good initially, but their insulin resistance is way high because they're on all these meat and animal products. So simple answer, I mean, the point is insulin resistance is getting worse, meaning technically your underlying diabetes is getting worse. So it should not be long-term. The second thing is cardiovascular risk. People die of heart diseases. There are a lot of other mechanisms to explain. I hate to bring it up, but I think, some, it might be a little bit of a counter to the, keto from the other people, but Dr. Atkins, who kind of advocated and promoted keto diet back in days, he had a different focal point and reasons to promote, but he had all his arteries clogged up on his health reports and all that when he died. So heart attack is the one. The third most important is the cancer risk. Cancer risk increases exponentially because the animal products, animal protein triggers is one of the fundamental root causes for a lot of cancers we have in nowadays. So you're worsening your diabetes, you're worsening your cancer risk and heart attack risk. If you're not worried about those three things, probably you can be on keto for life. But unfortunately, those are the leading causes of death across the world. So a month is okay. For a few months, maybe the 1 year. And once you get your weight goal and all that, you should transition to whole food plant-based. Just to close on one point, there's one big company called Verta, which is a diabetes reversal program. It's virtual, it's international. I think they have a huge market. But over time, what they have done is that's a keto dominant program. And slowly what they're doing is after 6 weeks of the keto program, because that's their signature product, right? They slowly transition every patient into whole food plant-based, or at least plant predominant whole food pathway. So you see the beauty where they end up. So if you want to try, but I think more plants is healthier in the long run. Sorry, that's a long answer, but hope that helps.
No, it does. It does. And just one more question, last one. So, are there any noticeable symptoms that we can be on the lookout for in relation to like lifestyle diseases? Like, I don't know if I'm like, how do I know that I'm diabetic, for instance? Like, I don't think
I
I
see.
am, but how do I check for that
Good,
without
good,
going to a
good.
doctor? Like, just to look at.
Mhm. Okay. Good. I think the two-part question, the clinical and then in a social setting, right? So meaning, yeah, the we call so-called, annual physical check, right? I think everyone, we all are supposed to go at least once a year, and that's where obviously these glucose check, A1C, cholesterol, everything will be checked. So obviously, if you get your blood work done, you will be you get to know my blood pressure, cholesterol, A1C, and diabetes range. I think your question was without going to the doctor, how do I know, right?
Yeah.
Blood pressure, you can buy a machine and check your blood pressure. That's easy. But in terms of A1C and cholesterol, there are a lot of private labs nowadays. It's a shifting market now. The small players are coming to the marketplace to take the traffic, whatever. You can go to their websites and then you can actually book. It's out of pocket. Basically, I'm willing to pay for this test. I want XYZ. Check my thyroid, my cholesterol, my diabetes, and everything. You are basically ordering online and paying and then getting them done, and you get the results to your email, and you can share with your doctor, or you can whatever you want to do with it. So the simple answer is there are some private labs. You can get them done without physician link. Other than that, does it answer your question, sir?
Yes, yes, it does.
Okay. Or if you're curious, one last tip in the sense, and I think everyone should look out, is in terms of diabetes, there is something called acanthosis nigricans, kind of fancy sounding technical term, but darkness around the neck. I'm pretty sure you have seen your friends and family who are like chubby and obese. The darkness around their wrist, their elbow, and then around their ears, especially around the neck.
Next.
Right? That's actually a clear, resounding evidence whether either you are, diabetic or you will be diabetic. Meaning that actually that represents insulin resistance right off the bat. Even if you're not diabetic or pre-diabetic today, you're heading that way because excessive insulin in the body and insulin resistance is what causes those, darkness. So without going anywhere, doing any test, just to stand in front of the mirror, if you have those lines, I think you should be alarmed, or anybody around you. That's an easy marker. Mhm.
Even the
Yeah, that's what I
urination,
was.
right? Urine frequency.
Right. Yeah. I mean, excess, we feel thirsty and hungry. I'm peeing more. I'm getting up in the middle of the night 2-3 times to go to number one. Absolutely, those are signs, but unfortunately, they're not early signs. They're already advanced. Because you'll be found with the 250, 300 sugars by the time if you're already doing that. But obviously, if you're doing that, I mean, yeah, it's in a you should be feeling compelled to go get checked.
Okay. Thank you.
Any other question before we close? Anyone else? Oh, good. So thank you for your time, Dr. K. It was really very insightful, and thank you really so much. I'll get this recording, Doctor, if you don't mind, and share it with those who could not join.
Absolutely, absolutely. Sure, sure. Just if I can take in a couple of seconds, I'm just going to flick through a few things just to emphasize for the completion's sake. As we talked about, this, eat, move, and sleep, but people are always, confused. Even in our regular practice, we never share graphical, meaning, representation to our patients. We just throw random numbers, but always remember, if your A1C is 5.7 under, you're not diabetic. 6.5 is diabetes. But we do get patients in our program, 5, 6, not just 7, 8, 9, 10, 12 as well, on hundreds of units of insulin, and they see the results. Right. So a couple of, just quotations. I just want to close, and I just want to leave the patient, our friends with some food for thought. This is one of our Ayurvedic quotes, one of my favorites. As you see, what it says is, when diet is wrong, medicine is of no use. When diet is correct, medicine is of no need. Meaning, if my diet is correct, I don't need medicine. If my diet is wrong, even the medicines won't work. I think, in other words, that emphasizes the importance of diet, and that is from our own Ayurvedic quotes. And this is one of the very leading, health journalist, Michael Pollan. He got Pulitzer Award as well. in his short little quick book. If you ever get a chance, read his In Defense of Food, or actually even the quicker book would be Food Rules. It's just a pocket book. And his take home is we always wonder what to eat, right? Eat food, not too much, mostly plants. Eat food means real food, not these processed and packaged and junk food. And not too much, meaning listen to your body. Even our Ayurvedic practices, our yoga, teach that when you feel full, you must stop. But we override that signal. And then mostly plants, and that's the take home. And finally, this man, Edison, right? Edison said, 100 years ago, that the doctor of the future will give little medicine, but will interest the patients in the care of human frame, diet, and in the cause and prevention of disease. So he himself, even though he's a huge entrepreneur, he's an innovator, he wants to cash every idea into business, right? But he himself emphasized the importance of prevention through natural way. So we just tend to forget that. And then with that, I think we're going to conclude today. I think today is what? May 4th? May the vegan force be with you, okay?
Yeah.
Thank you so much. Jayesh, you want
Thanks.
to?
No, yeah, thank you. Thank you very much, doctor, once again for your time and all the details. It really helps. A lot of people in our group are in India, so we'll be sharing the recording.
Sure.
And thank you very much for people who joined here. Thank you, Nikhil, for working with your doctor. We just form group, so we're just trying to motivate each other and be on this path of healthy, responsible eating, exercise, mental health. We are trying to work on all the aspects of life. That's where we are trying to head. This will definitely help us on that path.
Sure. Well, thank you, Jayesh
Thank you
and
so much.
Nikhil. I think this is a very exciting group. I'm glad I had a chance to kind of share a few nuggets. But we can meet in the future as well. But this is the last slide. If anybody wants to, interested in the program, learn about our program, they can go to our website or use the QR code. But thank you, I appreciate it, and hope it added some value to your time.
Yeah,
Yes,
thank you so
yes,
much,
yes.
doctor. Yeah.
Thank you.
Thank you.
Thank you.
Bye. Bye.